Have you ever found yourself reaching for the same familiar bottle of acetaminophen, hoping to ease those nagging aches that seem to visit more often these days? You are certainly not alone. For many of us past the age of 65, managing pain can feel like an unwelcome, never-ending chore. We have our routines and trusted brands, often recommended by family or by habit. Yet there is a challenge that many older adults face without even realizing it. The assumptions we make about how acetaminophen should be used after 65 can lead us astray, sometimes causing more harm than good. Imagine the relief that comes with finally finding a more effective, safer way to manage everyday discomfort. It is not about throwing away that bottle of acetaminophen, but rather about understanding where we might be going wrong. For seniors, well-intentioned habits can clash with our changing bodies. You might think you already know exactly how to take an over-the-counter pain reliever. After all, we have used it for decades. But the truth is, our bodies at 70 or 80 are quite different from when we were 40 or 50. That difference can turn the simplest of over-the-counter medicines into a balancing act between effective relief and potential side effects. Why does this matter? Because when used carefully, acetaminophen can help us stay active, keep our spirits high, and maintain the routines that bring a sense of purpose. We all want to remain independent, enjoying our hobbies and social activities without constant discomfort. Addressing how we use acetaminophen is about more than pain relief. It is about preserving mobility, preventing unwanted complications, and empowering ourselves with choices that help us feel better in body and mind. And the good news is, once you understand these pitfalls, you can transform your daily pain management approach into one that is safer and more effective. Over the next few minutes, we will explore 5 common mistakes many seniors make when using acetaminophen. You will learn how easy it can be to fix these oversights once you recognize them. If you have ever found yourself unsure about proper dosing, combining different over-the-counter drugs without a second thought, or ignoring the crucial role of professional guidance, the insights here will help you chart a clearer path. You will discover what can happen if we exceed recommended limits, why timing and dosage matter more than we might think, and how a few practical shifts can pave the way to better health. I have spent years listening to the stories and experiences of older adults who have navigated pain management. While I am not a medical professional, these conversations, coupled with guidance from research on safe medication use, have revealed what works best and what common mistakes are surprisingly easy to make. You will see how people just like you, dealing with similar aches and concerns, found themselves facing challenges that could have been avoided. By learning their stories and understanding the science behind these points, you will equip yourself with fresh perspectives and actionable strategies for better pain relief. As you follow along, think about your own daily routines. Have you ever experienced unexpected side effects or lingering doubt about whether you are taking pain relievers in the right way? Keep that in mind as we go through these 5 mistakes. At the end, you will have a clear idea of how to move forward confidently. Feel free to share your own insights or questions afterward, because the more we learn from each other, the more informed we become about protecting our well-being. First, let us shine a light on a particularly common oversight. Assuming that acetaminophen works the same way for us today as it did a decade or 2 ago. It is easy to think it is just an over-the-counter pain reliever. So what could go wrong? But the truth is, our bodies metabolize medications differently as we age. Mary, 72, used to pop a couple of acetaminophen tablets whenever she felt a twinge in her knee. She had done this since her 50s with no apparent problems. But recently, she noticed that her skin began to itch more than usual, and she felt persistently tired. At first, she chalked it up to aging, never considering that her habit of taking acetaminophen, often slightly exceeding the recommended dose, might be having an effect. A common misconception is that if an over-the-counter medication is available without a prescription, it must be harmless at any dose. In reality, as our livers naturally slow down in their ability to process substances, taking even a little more than recommended can be taxing. The risk of liver strain or other side effects grows when you combine these medications with other prescriptions or supplements. For Mary, a discussion with her pharmacist revealed that her daily totals were creeping above safe limits. By adjusting her approach, sticking to a strict schedule and never exceeding the recommended dose, she noticed her energy return and the itching subside within a month. Her story shows us how our physiology changes, even if the medication we use remains the same. Here is what you can do to avoid this mistake. Start by reading the label carefully each time you purchase a new bottle. Ingredients change, and instructions might differ from brand to brand. Keep a simple log of how much and how often you take acetaminophen. You can use a small notebook or your phone, whichever is easiest. This helps you see patterns and ensures you do not exceed daily limits. If you are unsure about how these changes affect you, speak to a healthcare provider or pharmacist, especially if you have liver issues or other chronic conditions. The physical benefit of properly adjusting your dosage is straightforward. You reduce the chance of overburdening your liver and other organs. You also spare yourself from potential side effects like persistent fatigue. Emotionally, there is comfort in knowing you are using your pain reliever responsibly. Without the nagging worry of whether you are taking too much or too little, you can focus more on activities you enjoy. This leads naturally into the second mistake many older adults make: failing to consider how other medications or supplements might interact with acetaminophen. In our later years, it is not uncommon to have a prescription or two, maybe more, alongside vitamins or herbal supplements. Sometimes we forget that these different substances can overlap in ways we do not anticipate. Joe, 79, is a good example. He was diligent about taking his blood pressure medication daily and occasionally used a sleep aid at night. He also liked to take a multivitamin in the morning. When he started experiencing a persistent headache, he reached for an extra-strength acetaminophen product, thinking nothing of it. Soon he felt dizzier than usual and had some stomach upset. After chatting with his doctor, Joe learned that certain over-the-counter sleep aids often include acetaminophen as well. By adding extra-strength capsules, he was unknowingly doubling up. This situation highlighted not just the need to read labels, but also the importance of making a list of everything he was taking to share with his doctor and pharmacist. One misconception here is that if different products are labeled for different purposes, like a nighttime sleep formula versus a pain reliever, there cannot be any overlap in ingredients. That is not always the case, especially for multi-symptom relief formulas. The new perspective to consider is that each product can contain hidden amounts of the same active ingredient, which can quickly put you over safe levels for the day. A practical solution is to consolidate your medication information in one place. Write down the brand name, the dosage, and how frequently you take it. Include vitamins, herbs, and over-the-counter meds. Share this list with your healthcare provider or pharmacist at least once a year, or whenever you start something new. Ask questions like, is there any hidden acetaminophen here? Or could this interact with something else I am taking? The physical benefit is peace of mind and reduced risk of liver overload or unwanted side effects. On an emotional level, clarifying your medication regimen can ease anxiety. You know exactly how much you are taking and why. Before we move on, feel free to think about your own medicine cabinet. When was the last time you reviewed all your bottles to see exactly what you are putting into your body? You might be surprised at what you discover. If you are already doing this, share how you stay organized and double-check your labels. Your experience can help others. Next, let us address a third widely overlooked mistake: relying solely on acetaminophen while neglecting non-medical pain management approaches. It is natural to assume that if you have pain, medication is the primary solution. Many of us have grown up believing a pill is the fastest way to relief. Yet medication alone, especially in older age, is only one piece of the puzzle. Consider Ruth, a 70-year-old retired librarian who suffers from arthritic knee pain. She took acetaminophen daily to cope, but the relief was temporary and the pain kept returning. Over time, she became discouraged and felt trapped in a cycle of taking more medication to keep up with daily chores. A friend suggested trying a gentle water aerobics class at the local senior center. Ruth was skeptical. She thought her knees were too sore and that exercise might aggravate her condition. However, after a few sessions, she noticed that her knee felt slightly more flexible. She still relied on acetaminophen, but now at a lower dose because the movement in the water supported her joints and improved her overall fitness. The misconception is that medication alone should handle pain, and if it does not, we might assume there is no real solution. The new perspective is to integrate alternatives that may enhance the effects of acetaminophen or even reduce the need for frequent dosing. Gentle exercise such as swimming, stretching, or short walks can strengthen muscles and support aching joints. Techniques like applying warmth or cold to affected areas, using relaxation methods to handle stress, and maintaining a balanced diet can all contribute to managing pain more effectively. Practical steps to try include starting with very low-intensity activities, maybe a short walk around the block or a few minutes of stretching in your chair. If mobility is a concern, look for modified exercises that can be done sitting down. Consult a physical therapist if needed. The goal is not to eliminate the need for acetaminophen entirely, but to create a well-rounded approach that supports your body from multiple angles. Physically, this can mean better mobility and less reliance on higher doses of medication. Emotionally, embracing various forms of relief can boost your sense of empowerment, reminding you that you can play an active role in managing your discomfort. This brings us to the fourth mistake, ignoring the maximum recommended daily limits because of the assumption that more is always better for severe pain. We sometimes think, if a couple of tablets help a little, then a few more should help even more, right? This is a dangerous path, especially for seniors whose bodies handle medications differently than they did in younger years. Frank, age 68, had persistent back pain after a minor car accident. Frustrated with the dull ache, he started taking acetaminophen several times a day. When the pain persisted, he reasoned that 1 or 2 extra doses could not hurt. But one evening he felt nauseated and noticed a strange, persistent fatigue. Worried, he visited his doctor, who discovered elevated liver enzyme levels. Although his doses did not seem wildly high to him, they were indeed pushing him over the recommended daily limit. After reducing his intake and exploring targeted physical therapy, Frank's symptoms gradually improved and his energy level returned. The misconception is believing there is a big buffer zone between the recommended dose and a harmful one. In reality, the safe maximum for adults is generally up to 3,000 milligrams per day for extended release forms, though many sources say 4,000 milligrams can still be acceptable. For older adults, it is often advised to stay on the lower end. The new perspective is understanding that just a little more can add up quickly, especially if you are not accounting for the acetaminophen that may be hidden in other over-the-counter products. You can avoid this pitfall by knowing the exact strength of each tablet or capsule you take and tracking your total daily intake. If your pain is severe enough that you are tempted to exceed the recommended doses, it is time to talk to a healthcare provider about alternative strategies or additional therapies. The physical benefit of staying within limits is avoiding serious complications like acute liver injury. Emotionally, there is reassurance in knowing you are acting responsibly and not jeopardizing your long-term health for the sake of short-term relief. If you have made it this far, take a moment to reflect. Have you ever been tempted to take just a bit more because the pain was intense? Have you considered safer alternatives when daily living gets tough? Feel free to share your thoughts or talk about any strategies that have worked for you. Sometimes hearing about someone else's approach can spark a solution we have not tried. Finally, let us tackle the fifth mistake, which might seem counterintuitive. Delaying medical advice because we assume that occasional minor discomfort is not worth mentioning. It is easy to overlook pain that starts off mildly. We think, it's not that bad. I'll just take some acetaminophen when needed. But small aches can turn into bigger issues over time, especially for older adults. Helen, 74, often brushed off her hip discomfort as just a twinge. When it flared, she took acetaminophen and soldiered on. She never thought to mention it to her doctor. Over a few months, that twinge evolved into a sharper pain that interfered with her sleep. By the time she finally brought it up during a routine checkup, an underlying joint issue had become more complicated to treat. Had she discussed it earlier, she might have started a gentle physical therapy regimen that could have slowed or even prevented the progression of her condition. The misconception is that doctors only want to hear about major health problems and that occasional pain is something we can handle on our own. The new perspective is recognizing that pain, mild or severe, can be a signal from our body that something needs attention. This does not mean every ache is critical, but it is worth checking in with a healthcare provider to rule out underlying conditions. Practical steps include bringing a short list of questions or concerns to every doctor's appointment. If you find writing things down helpful, jot a note in your calendar whenever you experience discomfort. Record where it happened, how long it lasted, and what helped relieve it. This kind of diary can be invaluable to your doctor or pharmacist, who can guide you towards safer dosage levels or more comprehensive treatment plans. Physically addressing issues early can prevent them from becoming chronic or disabling. Emotionally, being proactive with your healthcare fosters a sense of control. Rather than waiting for pain to become unbearable, you stay one step ahead. Now that you have heard these 5 mistakes, it is worth pausing to consider how applying these ideas could transform your daily life. Being mindful about acetaminophen use is not about living in fear or complicating your routine. It is about understanding that small, smart adjustments can help protect your well-being. By paying closer attention to dosage, interactions, complementary approaches, safe limits, and timely medical advice, you open the door to a better quality of life. It is crucial to act sooner rather than later. Pain that goes unchecked has a sneaky way of robbing us of mobility, independence, and even social connections if we start avoiding activities. Yet there is no need for alarm. Think of this as a friendly nudge that you can take meaningful steps right now. Simple things like reading labels more carefully, discussing your medication list with your doctor, and exploring alternative relief strategies. Each of these actions, while small on its own, contributes to a safer, more effective pain management plan. If you are ready for something more comprehensive, you might schedule a medication review with a trusted healthcare professional. This can help ensure you are not inadvertently doubling up on acetaminophen or missing a better treatment option. If you want a moderate step, consider exploring a gentle exercise class, physical therapy, or alternative therapies that can complement your medication. On the simplest level, you can start by just keeping track of your daily dosage and noticing how your body responds. The life you envision, where pain is under better control and you feel freer to engage in hobbies, outings, or gatherings, is far more attainable when your pain management approach is tailored to your current needs. Each year after 65 can bring new joys, but also new challenges. Your willingness to learn and adapt plays a huge role in how these years unfold. You deserve solutions that keep you feeling confident and capable. By putting these 5 tips into practice, you are stepping into a more informed version of yourself. Rather than treating pain medication as a quick fix, you will see it as one tool among many for staying active, healthy, and connected. Share what you have learned with your friends, neighbors, or family members who might be struggling with similar issues. You might be surprised at how many people have quietly harbored concerns about whether they are using acetaminophen correctly. Your story and insights could inspire them to seek safer, more effective ways to relieve pain. If you found this helpful, you could start by doing a quick inventory of your medicine cabinet. Check for overlapping ingredients and write them down. Or if you feel your pain is beyond what acetaminophen can handle, reach out to a healthcare provider soon. Leaving these concerns unaddressed can escalate them to bigger problems later. This is your health, and you have a right to the best options available. You do not have to make dramatic changes overnight. Small, consistent improvements will add up to greater comfort and peace of mind. With each step, you gain confidence and reclaim parts of your life that pain might have overshadowed. Whether you decide to talk to your doctor tomorrow, reevaluate how much acetaminophen you are taking each day, or look into gentle exercises to support your joints, you are making an active choice to care for yourself. Above all, trust yourself. You have navigated many phases of life, learning and adapting with each one. Now is no different. With a bit of knowledge, some caution, and a dash of curiosity about new methods, you can continue to make the most of every day. Remember, you are not alone on this journey. Many others share your experience, and by speaking up and supporting one another, we can all enjoy a healthier, safer relationship with the medications that are supposed to help us, not harm us. Thank you for being here, for investing time in understanding how to manage your pain responsibly, and for staying open to fresh ideas. If you found this information beneficial, feel free to share it with a friend or family member who might also have questions about acetaminophen use. If you are ready for the next step, consider scheduling that quick chat with your pharmacist or healthcare provider. And if you simply want to keep learning, stay connected by checking out more resources on senior health. Together, we can keep discovering safe, smart ways to maintain our well-being. You have the wisdom, and now you have even more knowledge to match it. That is a powerful combination. one that puts you firmly in control of your health choices and your path forward.